DANB RHS Exam Dental Assistant Practice Test and Study Guide, 35 Most Asked Questions. Question 1. Who discovered the X-ray in 1895? C. Edmund Kells, Wilhelm Röntgen, William Rollins, Otto Walkhoff. Wilhelm Conrad Röntgen discovered X-rays. Question 2. The ALRA concept stands for as low as reasonably achievable, always lower any radiation amount, as long as reasonably acceptable, average level and radiation area. ALRA is the principle of keeping radiation exposure as low as possible. Question 3. Which part of the X-ray tube head filters out long wavelength, low-energy X-rays? Collimator, aluminum filter, tungsten target, lead-lined PID. Aluminum filters remove non-penetrating, low-energy radiation that only increases patient dose. Question 4. What is the function of the collimator? Increase the energy of the beam, restrict the size and shape of the X-ray beam, filter the beam, produce electrons. The lead collimator limits the beam size, usually to 2.75 inches at the skin. Question 5. Which of the following is the most radiosensitive tissue? Muscle, nerve, bone marrow, mature bone. Rapidly dividing cells, like bone marrow/reproductive cells, are more sensitive to radiation. Question 6. Excessive vertical undulation causes an image to be elongated, foreshortened, overlapped, clear. Too much vertical angle makes the teeth look shorter than they are. Question 7. Insufficient vertical undulation causes an image to be elongated, foreshortened, overlapped, blurred. Too little vertical angle makes the teeth look longer than they are. Question 8. Overlapped contact areas on a bite wing result from incorrect vertical undulation, incorrect horizontal undulation, patient movement, using too much radiation. The horizontal beam must be directed through the interproximal spaces to avoid overlap. Question 9. The lead apron with a thyroid collar should be used for only panoramic films, only bite wings, all intraoral radiographs, only pregnant patients. Lead aprons protect the patient's vital organs from scatter radiation during all intraoral shots. Question 10. Which of the following is a safety rule for the operator? Stand at least 6 feet away from the tube head, hold the film in the patient's mouth, stand in the direct path of the beam, hold the tube head during exposure. The operator should be 6 feet away and at an angle of 90 to 135 degrees to the beam. Question 11. What is the term for a fuzzy or blurred outline on a radiograph? Density, contrast, penumbra, resolution. Penumbra is the partial shadow or blurriness around the edges of an object. Question 12. Dense structures like enamel and bone appear on a radiograph. Radiolucent, radiopaque, gray, transparent. Radiopaque structures, white/light, resist the passage of X-rays. Question 13. The bisecting technique is based on the rule of parallelism, isometry, inverse square, reciprocity. Sierzyński's rule of isometry states that two triangles are equal if they have two equal angles and a common side. Question 14. What is the main advantage of digital radiography over film? Higher cost, less radiation for the patient, slower results, requires more space. Digital sensors are more sensitive and require 50 to 90% less radiation than conventional film. Question 15. A cone cut occurs when the film is overexposed, The X-ray beam is not centered over the film. The patient moves. The developer is too hot. Cone cutting results in a clear unexposed area on the film because the beam didn't cover it. Question 16. The NPD maximum permissible dose for an occupationally exposed person is 5.0 rem/year, 0.1 rem/year, 10 rem/year, 0.5 rem/year. The annual NPD for radiation workers is 5.0 rem, 0.05 SV. Question 17. What happens if the developer solution is too warm? The film will be light. The film will be dark. The film will be clear. The film will be green. High temperatures speed up the developing process, leading to an overdeveloped, dark film. Question 18. The processing step that removes unexposed silver halide crystals is developing, rinsing, fixing, washing. Fixing clears the film and hardens the emulsion. Question 19. Which size film is typically used for adult bite wings? Size 0, size 1, size 2, size 4. Size 2 is the standard adult intraoral film. Question 20. Radiation that has been deflected from its path by impact with matter is called primary radiation, secondary radiation, scatter radiation, stray radiation. Scatter radiation is a form of secondary radiation that is dangerous to the operator.